much urine do you think your bladder can actually hold? As women in this midlife season, we are often joking about our small bladders, right? And how often we are running to the bathroom. But my guest today says there is no such thing as a small bladder. If you have moments of leaking, pain, or discomfort, you really could be dealing with a very real issue called prolapse, not just another symptom of menopause. So you will want to lean into my conversation with my guest today, Jenn Lormand, for some important potty talk that will make you think differently about those constant bathroom runs and your pelvic floor as a whole. Let's dive in. Everybody, it is so good to have you back here on the Treasured Wellness Show. Let me tell you about my guest today. You are going to be so riveted to this conversation, I promise. Jenn Lormand, she is published researcher, exercise physiologist, and author, and she's been living and thriving, yes, with stage 2 prolapse. Ooh, prolapse, there's the word. Do we talk about that much? For more than a decade. And Jenn and her Tinkler co-founder, physical therapist Christina Walsh, they have a combined 38 years of experience giving support for women with prolapse and diastasis recti and many more. So we're going to be using some words that maybe you're not familiar with, that maybe even your GYN is not talking about or checking for. So Jenn likes to mix real stories with actionable advice, which I love because it's all about the doable. What can we do that doesn't make it so hard? And she delivers her message of hope and healing while remaining centered in faith. Ladies, this is why I bring you the amazing guests that I do, because sometimes it's to educate. Yep. And sometimes it's to reiterate health information, and sometimes it's to get out into the open what is not being talked about in women's health, especially in this midlife season, this perimenopause, menopausal season, and beyond, even postmenopausal. Women's health is super complex. We know this, and no topic should be off limits, and it's not here on the TW show. So this is going to be a powerful time together. I am so happy to talk with you today, Jenn. Welcome.
Thanks so much for having me, Michelle. Very happy to be here.
So I always like to ask my guests, what are you treasuring right now in this season of life?
I think I'm treasuring time. My two oldest are in college, and as we get older, it seems like the clock just ticks faster. And so I am just treasuring special times with my family, small pockets of time during the day to just give thanks for all the gifts that God has blessed me with. And that includes Tighten Your Tinkler and, Christine and I call it our ministry to really help educate women about what's happening in their body, and most of all, provide this sense of hope for healing.
I love that. And, I didn't even realize that prolapse was a thing, a real thing, until well over 10 years ago, not only with my training, but my holistic and functional training, but because I experienced it personally and I was like, what the heck is going on?
Yes.
So I had no idea. And fortunately, I had a good GYN who was able to help me understand that. And I might share a little bit more of my story later, but let's just jump in because this is not talked about. Like, we don't really go there much, if hardly at all. And we need to bring awareness to this. And so I'm so glad that you and Christina are doing this. What would be some signs, common signs of women over 40 that they are experiencing that is showing that her pelvic floor is not functioning as optimally as it should be?
Yeah, well, Michelle, the list is very long. And typically women are not connecting the dots that all of these issues are actually connected to your pelvic floor. So we'll start with the one that most women recognize, which is P leaks. Right now, this can be with urgency, like all of a sudden you really have to go to the restroom, and if you don't get there soon, you're going to have an accident. But this can also be pee leaks with coughing, sneezing, jumping, laughing. And there can also be something called overflow incontinence, where with position change, you leak urine. All of those things, none of that is normal at any age and not something that you have to accept. Another one that women have so deeply accepted is peeing more than 10 times a day, regardless of how much water you drink, because it's the first thing. I drink so much water. All of our bladders are able to hold at least a cup and a half to 2 cups of urine during the day and 3 cups at night. So pee frequency is an issue, and this can be related to, if you have an over tight pelvic floor, you're not able to completely empty the bladder, and therefore you're having to pee more often, which is generally the reason. Or just that up and in support that the pelvic floor gives to our undercarriage. If that is loose, so to speak, or weak, you're going to have to empty your bladder more frequently, because the nervous system is going to tell your body that you need to empty your bladder more frequently. Another one is back and hip pain. This is one that many women experience. Typically pregnancy is the impetus for the onset of some of these symptoms to begin, but that's not necessarily always the case. We have worked with women who haven't had children, but typically the back tightness, pain, feelings of compression, or tightness at the side or front of the hip, this is a sign of pelvic floor dysfunction. Pain with intimacy. Now, a lot of women tend to think that that's pain with insertion. That is not always the case. This can be pain higher up in the abdomen, or this can feel like swelling and inflammation post intimacy. All of that would fall under the umbrella of pain with sex. So that's an issue. We also have just a general symptom of feelings of heaviness, both in the pelvis or in the lower abdominals. Very common with prolapse in particular. And then you have more of the rectal symptoms. So these are, passing gas beyond your control, leaking feces, whether that is, with position change, with hard stool, or with more loose stool, losing control of the bowels. And so all of these different things are connected to pelvic floor dysfunction.
Wow. Okay. Yeah, that's a long, long list for sure. And I'm sure there were even more specifics you could have gotten into. It's interesting. I do have a question. You said back and hip pain. Is that side specific?
It isn't, because our pelvic floor is literally a bowl of musculature. So, when you think about muscle origin and insertion, where it's inserting onto the skeleton, onto the bones, it's literally full circle, so to speak, in the pelvis. So some women complain more of tightness, clicking, popping. A lot of women will start with this clicking and popping of their hip with particular core exercises. This can be due to hypertonicity of the pelvic bowl, more on one side. And these things can be very complex, right? If you've had a hip replacement, or if you've had a previous orthopedic injury in the low back or the hips, the pelvic floor is deep to, it's deeper inside the body than that other muscular tissue. But there are impacts, that scar tissue from that injury or whatnot grabs onto the pelvic floor as well, and can create tightness on one side of the pelvic bowl, which, over time, this is a progressive issue. So over time, these things will get worse if nothing is done about it.
I'm so glad you expanded on that, because I've had in my coaching, I've had some clients come to me with specific back pain hip pain. And, because I do testing and things and they're coming to me for hormones, that is also a concern. But if everything comes up okay, then that is the next question or a next question, like how, going down the rundown of pelvic floor. And a lot of women have never heard of a pelvic floor therapist, and I know I didn't years ago. So that's telling too. The other thing that you say, I love that you say there's no such thing as a small bladder. I think I read that on your
Yes.
website, and I just love that because that was my cop out forever. I have such a tiny bladder, and really, I have blamed it on my second child, my daughter, like her whole life. She's 21, she's 21, she's 28, goodness. She stomped all over my bladder, and ever since then, I've kind of blamed her for the steady running to the bathroom. But then I found out about prolapse. I found out that I had prolapse, and I don't blame her as much anymore. But can you dig a little bit deeper into that?
Yeah.
Because I've heard that and I've said that, and I know somebody listening is saying that too.
Yeah, well, prolapse, if let's define what that is. So all
Yes.
it is it's a falling of the pelvic organs into the pelvic cavity. And so when I mean, for your folks watching on YouTube, I'll hold up this picture. Christina and I actually have a master class called Prolapse 101, and we have videos on YouTube if you want more. But you can see, here is the bladder right here, and it's neatly stacked. Here's uterus, and here is rectum, which are the three compartments that we're really speaking about. Now, the prolapse is where these compartments kind of go away. The tissue collapses, and all of these fall down into the pelvic compartment. And I apologize. I normally have a picture of my prolapse that I use in teachings, but I couldn't find it before this interview. But so what happens is you've got an increase in this pelvic pressure, and it causes a lot of discomfort, but it also causes pain. And this is something that Christina and I have kind of gone back and forth with a couple of other physicians on, because there are many physicians with the opinion of prolapse doesn't hurt. Well, it actually does, because all of these organs, their ligamentous attachments are on the backside of the pelvis. So
Mhm.
I always liken it to like you have these books on a shelf. The books are falling off the shelf and being held by this cord that's tethered onto this bookcase. Well, eventually the bookcase is going to start wanting to come off the wall too, right? And so it is painful, and it does pull on the low back. We also have in our nervous system, you know, part of what tells us that we have to empty our bladder is part of our nervous system. The nerves say, hey, the bladder is full, when in certain positions, not necessarily that you have too much fluid in your bladder. Um, and so it causes all kinds of problems in this vaginal canal. In regards to pain with intimacy, you can see here's the uterus and here's the long vaginal canal. Well, as the uterus falls down with intimacy, there's nowhere for your husband's penis to go, right? You're literally bumping up into the uterus. And so it creates sometimes like a pressure differential that can cause leaking of urine, or, certain sounds during intimacy. And so it can cause a whole host of issues physically, but also emotionally. So,
Absolutely.
I mean, and that was certainly the case for my husband and I. I was diagnosed after I had my third son, and sex was painful. And the last thing you want to do is go to your husband who loves you so much and say, this act of love is hurting me. It's producing anxiety in me, and it's also embarrassing to bring up with your practitioner, right? Which is part of the reason. One of the resources that Christina and I did create is something called the Intimacy Guide, to help you craft that conversation to have with your husband.
Hmm. Yeah, that's so important. I'm right there with you. I experienced that as well. And that brings me to your visual is perfect. So if you guys are listening on audio, take some time to go over to the Treasure Wellness YouTube channel so that you can see the visual that she's showing us. But my question is, what about after a hysterectomy? Like, what happens then? Because, I mean, would you say prolapse is a little more imminent after that?
It is absolutely eminent because your uterus is holding up tissue in your pelvis. And so, and your physician knows this, your surgeon knows this. That's why they automatically do a bladder tack when they do a hysterectomy, because they know that when they take away the uterus, the tissue that the uterus was holding up is going to collapse down. It's called vaginal vault prolapse. And it puts, if they don't do that bladder tack, women end up with a bladder prolapse. Um,
Okay, yeah, that's very true. I had a hysterectomy. I had the bladder tack up, and that was whew, right in the middle of all that mesh mess years
oh,
ago.
goodness
But
sakes. Yes.
praise God, everything is okay. I'm claiming that. So, that is so important. And do most surgeons, they all do this bladder tack up? I mean, in some way, shape, or form?
Yeah, I mean, they
Okay.
offer it as an option, but they definitely encourage all women to take that option because they know the consequences. They're not going to tell you, hey, when we remove your uterus, it's going to cause vaginal vault prolapse, but that is what's happening.
Yeah, because
Um,
it's crazy that that's not an automatic discussion. It was for me, but it's not for everybody. I was talking with two women several months ago, and one was saying, yeah, I wasn't told until after my surgery that in 10 years my bladder will start to fall. I'll start to have
yes,
problems. Then why didn't you do something then? And so the other woman was there getting ready to have a hysterectomy. And so it sets up some anxiety. And if you don't
yes,
have the lines of communication going really well between you and your doctor, um, yeah, these things are embarrassing to talk about, but it's your body and you are your own best advocate for your health and wellness.
yes,
And so it's really important. We just have to be very factual, right? Just like we keep the emotion out of it, we got to separate the embarrassment because it's going to be more embarrassing if we don't deal with it
that's
now.
right. That's right. Yes, I totally agree. And it is important to advocate for yourself. I mean, that's something that Christine and I are extremely passionate about and talk quite a bit about in our masterclass because unfortunately, and it's, I don't blame the doctors per se. They're not, they're not trained on a lot of these things. Medicine has become very compartmentalized. And so they
Right.
are usually doing their very best to give you the information that they have, but
Okay.
there are downstream consequences. And I do want to just add, even if you've had a hysterectomy and a bladder tack, it is still a great idea to strengthen your undercarriage because you may not need to have another bladder tack in 10 years if you strengthen that undercarriage in your pelvic floor.
Right. So that brings me to okay. When would be the time to address it? Obviously, you gave us a list of fabulous symptoms that we can be thinking through. But what are some, give us that answer, and then what are some doable and practical ways? We always want to keep it practical. How
Yeah.
can women help to strengthen their pelvic floor without expensive tools like these lovely
Mm.
vagina balls? Exercise weights. Yeah, I had prolapse, guys, so that's what I was told to do. Anyway, you can share your thoughts on that too.
I
But yeah, take the
will.
floor, take the floor.
Well, so part of Christina and I's mission is to help women, is to help restore our dignity, right? Many of the women who are dealing with these issues have previous trauma,
Right,
whether that's birth trauma, whether that's some type of sexual abuse. And so, God did design our bodies for healing. I think it's really important for women to hear that, believe that, accept that. And oftentimes it is just with these gentle nudges. Now, I'm not going to tell you that if you've been diagnosed with a stage 4 prolapse, okay, prolapse is stage and graded from 0 to 4. We can best help women stages 0 to 2, and we proved that in the research that we published. Stages 3 and 4, unfortunately, are better candidates for more invasive therapies, like a pessary, and unfortunately, with stage 4, surgical intervention. So we're very passionate about helping women to understand that when you recognize you've got these symptoms, that's why we have a quiz on our website. It's free. We want you to take the quiz. We want you to connect the dots and look at that score, because if you're in the green or the gold zone, this is the time where non-invasive interventions can work really, really well. And so this is just through using recovery tools. And what we mean by that are really simple things like, don't push your pee out, because that's going to make you pee more times a day. You're worth the extra 5 to 10 seconds to breathe and let your pee out. But also don't push your poop out. You know, many women dealing with rectal issues, rectal prolapse, rectocele, have other digestive things going on. Maybe that's IBS and Crohn's. And I always like to put that caveat that before you can address the rectal prolapse, you really have to get your hands around that chronic condition, whatever the impetus is that's creating the diarrhea and the constipation. But in the meantime, getting something like a toileting stool or creating your own, I mean, like I show on our Instagram and YouTube, take 2 empty yogurt containers, turn them over, right? And pop your feet on top of them. It's pretty simple, but do that each time you use the restroom, because ergonomically, that helps the rectum and pelvic floor actually relax, and it's going to allow the passage of stool to come out easier than straining.
Right.
Something else is not wearing compressive garments. You heard us talk a lot about with prolapse, it's a pressure differential. And, you know, if you're wearing something that's too compressive around your middle, Christina did a great reel on our YouTube page, or on our Instagram page, where it's like squeezing a tube of toothpaste in the middle. You know, that pressure has to go somewhere, and it's down, and that's your pelvic floor. So, you know, God bless Spanx and all that. I'm not saying, you know, if you don't have prolapse, wear them. But if you have it, you know, you're going to notice after you wear that, you have more pain in your abdomen. You have more pressure and swelling, heaviness. That's your body waving that red flag saying, I don't like this. Please stop. Right.
Yes.
Another simple fix is if you know that you're having pressure, heaviness, or any of the symptoms we talked about, please don't wear the heels. You know, when you're in heels, it changes the pitch and projection of your pelvis, and there's more of that downward pressure. So it's going to provoke more symptoms. And it can also, if you're wearing heels constantly, it can progress the condition. So you want to stay away from that. You also want to stay away from Kegels. I know I said it out loud.
Say it loud and proud. They're so hard and difficult anyway.
You know, when we know better, we do better. And, you know, I was a big promoter of Kegels 21 years ago after I had my first baby. Kegels helped me. I called myself a Kegel queen. But guess what? When I was diagnosed with prolapse and I was examined, the urogynecologist kind of popped his eyes open when he asked me to perform a Kegel, because my pelvic floor was strong, but my pelvic organs were still falling out of me, right? So what we know about Kegels is that is contracting a muscle in one position isometrically, and it's not functional. And so it can also create more hypertonicity, which we talked a little bit about in the beginning, which can exacerbate a lot of symptoms, right? Because it can create that over tightness in the pelvic floor that you don't want. So stop the Kegels, stop the straining, stop the compressive garments, no heels, diaphragmatic breath work. You can find a ton. We give away a 90-90 decompression video technique showing you how to decompress your pelvic organs while doing diaphragmatic breath work. This is so incredibly powerful. And if you want to make it even more powerful, what I tell women to do and what I do myself is that's your 10-minute prayer break, right? So you're tuning in, you're doing something for your mind, your body, and your spirit. It's super powerful. Highly recommend it. And these are all really meaningful changes that you can make that can have a true impact if you're dealing with these issues.
Yeah, I definitely agree. I tell my clients, nobody's going to bother you in the bathroom. So that's when you take that time and do your deep breathing, which now what you're saying, Jen, is take a few extra seconds, don't push out your urine and just breathe and let it come
Yes.
naturally. And then you'll
Yes.
probably empty your bladder a whole lot easier. And you'll feel more relaxed. Your shoulders will come down, your tension. And I know it sounds weird. You're on the toilet and you're deep breathing. Yes, yes. Because it's too hard once you get back to your office, your desk, whatever. It's too difficult to do it then. So the bathroom is the best place. I know we're running out of time, but I really need to focus a few minutes on the nervous system. Okay.
Yes.
Because oh my goodness. I want to talk about the role it plays with prolapse,
Mm,
constantly helping my clients get out of fight, flight, freeze, and fawn
yes.
state. And I know I didn't get the connection years ago when I went through my fiery trial and it just threw me into, stage 3 adrenal fatigue, all of that mess, my burnout
Yes.
phase that my prolapse was worse during that time. Wasn't getting the connection. I was just trying to do all the things and stay alive, basically. So,
Yes.
I've had women tell me that suddenly, I'm doing air quotes here, they
Yes.
developed prolapse after a really long time in a caretaking role. Please,
Yes.
please dissect this for us.
Ugh. Well, I mean, there's so many things, right? There's so many facets in midlife, right? And you hit the nail on the head, which it's a time where a lot of things come to a head. We're
Yeah.
usually taking care of elderly parents. We have
Mhm.
kids that are either almost out the house or out the house and still need us. And it's a very high time of life for a lot of stress, which increases cortisol. You throw perimenopause into that, where there's a decrease in estrogen, and it's puberty times 100,
Right.
right?
Right.
And so there's so many different things that are happening. Cortisol is up and down, so rest is not great, and our bodies need rest to have a shot at healing, to have a shot at getting back into that parasympathetic system, which is where true healing, that rest and digest
Yep.
state, takes place. And so that's another reason why we are such a big proponent of that 90-90 decompression position, for two reasons. When you put your hips higher than your heart, and surgeons know this, it's called the Trendelenburg position. Anytime if you've had surgery, you've noticed that your head is slightly lower than the rest of your body because it literally changes your sinus rhythm in
Yes.
that position. So, let's use all the cheats that we can, right? So that's cheat number one, to help decompress that vagus nerve.
Yes.
Um, the diaphragmatic breath work, yes, it helps to slow things down, to change your vagal tone, but it also, from a physical perspective, is trying to help sync your your diaphragm, your respiratory diaphragm, with your pelvic floor, which is also a diaphragm. And those two should be working in sync with one another. And when they're out of sync, that's when you're going to find you have more urgency. You're peeing more often. You're having more pain because it changes the feedback loop and the patterns in the brain. And so it perpetuates. I mean, I'm sure you know this as a functional med specialist. There's documentation of the patterns in the brain and how it kind of gets sets up into this feedback loop automatically when you're in chronic pain. So, doing diaphragmatic breath work, getting in that position, taking Epsom salt baths, and getting enough magnesium in your
Hmm.
body. Oftentimes at this stage of life, we have a lot of gut issues. And so, if
Yes.
you're taking pills, they're not getting digested. So we have to go, the dermal route, which is using magnesium oil, using magnesium salts,
Hmm.
huge proponent of that, to help regulate the nervous system. Um, yeah, it is a challenge, but it can be done. And let's not forget about all of the medical documented research in the power of prayer that
Right.
can help get your body in more of a parasympathetic state.
Right.
Um, even small prayers. I mean, there are medical journals that have documented people who have had people come and pray over them while they're in the hospital get better more frequently than people who no one was praying for them.
Hmm.
I mean,
Yeah.
so there's something to it,
True.
whether you're doing it, whether other people are doing it for you. Do not, disregard the power of prayer.
Absolutely. Absolutely. We've talked a little bit before we hit record that it's so vital that we address the spiritual parts of ourselves for our true healing and restoration. That's why it's a huge component, the really a gigantic component in the midlife health makeover because it has to be. If we really want that transformation, we need to seek the Lord for it, plain and simple. He's the great physician. So
Yes.
I love this conversation. I could keep you for another half hour or so, but because of time, would you leave our listeners with a little bit of encouragement, a treasured truth?
Treasured truth. I love that. I mean, you know, healing is possible. I truly I believe that with every fiber of my being. I believe that we are created in God's image, and um, that our bodies are created for healing. Sometimes, you know, healing might not happen physically, um, but sometimes it happens more emotionally and spiritually. Um, but I encourage women to not give up hope. I know this midlife season can be challenging. I mean, many of us are carrying very heavy crosses. Um, yoke yourself to the Lord, talk with Him often, and know of His love and compassion and mercy and grace that He wants to give you in this season and every season.
Amen. That's perfect. That is a perfect way to end. Always, always seek the Lord. Okay. Thank you for that. Thank you, Jen. This has been so incredibly helpful. How can my audience find you? Give all the details.
Yeah, so we are on YouTube, we are on Instagram. You can find us Tighten Your Tinkler. You can also head over to our website. We've got that quiz, and we also have a very long resource page where podcast interviews, videos that we've done, freebies that we offer. I know I mentioned a couple of those. um, it's separated by symptom, so you can click on the issue that you're having and it will take you to the list of resources there, that are available based on that symptom. We also have an online signature program that can actually help women get to the root cause of the pelvic floor issues. I would encourage women to first take that quiz to make sure if that's a good fit for them. And we also have a special gift for your listeners. If they use the code treasured at checkout, they will get $50 off of our signature program.
Awesome. That sounds so great. And of course, you're bringing that functional holistic approach, and that's what we need. We didn't even get into the details. I'll have to bring you back on, Jen,
That would be
because
fun.
this is such a tough topic that needs to be talked about, and it can be so confusing. So,
Yes.
we don't want it to be confusing. We want to bring awareness to this. So, thank you so much for coming on Treasure Wellness
Uh,
and sharing your story and your expertise with us.
Thanks so much for having me, Michelle. Pleasure.